And according to this nationwide survey, more doctors smoke Camels than any other cigarette. Try Camels yourself, the cigarette so many doctors enjoy.
Death toll linked to vaping is climbing tonight.
His infected lungs nearly collapsed.
Colorado's first case of a rare vaping-related illness.
There was yet another death connected to the use of e-cigarettes.
Nicotine exposure during adolescence can uniquely harm the developing adolescent brain.
Reporting that some vapers are now seeking relief from their nicotine addiction by turning back to regular old cigarettes.
I believe that nicotine is not addictive.
There is a very strong relationship and probably a causal relationship between heart disease and cigarette smoking.
Smoking is one of the most detrimental habits a person can acquire. In 2011, an estimated 11 million people worldwide were vaping. By 2023, this figure is projected to increase to 86.1 million. One might assume that treatment for such a hazardous habit would be highly effective. However, this is not the case. A study published in the international peer-reviewed journal Tobacco Control reveals that the most effective treatment options currently available, such as nicotine patches, are only mildly effective or not effective at all in helping people quit smoking. This is primarily because researchers tend to focus on one aspect of addiction, nicotine cravings. Research indicates that smoking involves more than just a simple nicotine addiction.
Smoking is one of the most widespread practices that adversely affects the circulatory system and respiratory system, may contribute to the development of many diseases, including cancer, and may even cause death. Women and men at different ages exhibit this behavior in many countries worldwide. There are a variety of medications and pharmaceutical forms available in the market to assist smokers in quitting. However, many smokers do not accept the notion of taking medication or may not continue to do so, resulting in ineffective treatment. This is why we developed a method for taking the medication in an attractive format that will allow smokers to continue taking their medication in a way that suits them. Our idea is to make a product that looks like an electronic cigarette and replace the nicotine with a drug called Varenicline used for smoking cessation. Electronic cigarettes or vapes use heat to convert the liquid into vapor. We cannot use the same technique with the drug as it can affect stability of the drug or damage it. Thinking about the nebulizer technique is a good idea. However, it needs a compressor, and it is hard to make it small in size, as well as it needs a special piece of equipment like mask to ensure that the patient will take the right therapeutic dose. Finally, we think about using the humidifier technique that uses electricity and a cotton swab to convert the liquid into vapor, which is a simple technique with few parts and without heating the drug. Varenicline electrical cigarettes target both the addictive and physical aspects of smoking, such as hand-to-mouth movement, smell, and visual cues. Our product maintains the familiar shape of a vape to facilitate a smooth transition from smoking addiction to smoking abstinence. The main parts used are battery, circuit board, wires, cotton swab, humidifier, glass container, and mouthpiece. The drug will be added to the cotton swab in a solution form in a specific volume and drug concentration as the recommended dose. The battery will work as an electrical source for the electrical circuit that will activate the humidifier to convert the liquid into vapor to be collected in the glass container, ready to be inhaled by the patient through the mouthpiece.
The American Thoracic Society recommends that all individuals attempting to quit smoking and who are dependent on tobacco begin with Varenicline. As a nicotinic acetylcholine receptor partial agonist and antagonist, Varenicline stimulates this receptor, triggering dopamine release in the forebrain. It also occupies and blocks the receptor site, thus preventing nicotine from having its effects when and if smoking occurs. This approach allows patients to experience some dopamine release without the harmful side effects of traditional smoking. In chemistry, it is often said that like dissolves like. We believe that also like cures like. We are using smoking to quit smoking. We believe this is the best treatment option to achieve smoking cessation once and for all. Our vision is that one day, smoking will no longer be a public health issue.